so we have Erin Murray here, 3 times world's strongest woman in multiple weight classes as well. We're going to go through a hip assessment, looking at lower body, trying to figure out if there's any mobility restrictions, any considerations that we need to put into her training, both to open up range of motion and then potentially avoid any unwanted injury or wear and tear. So the first thing that we're going to do is a Thomas test. So this is going to be a table test. So I'm going to have you sit towards the edge here with your feet hanging off. And then let's go with the right leg first. So I'm going to have you hug your right leg into your chest. Then we're actually going to lay back very slowly. And now this is assessing this left leg here. So a couple things that we're looking for in this Thomas test is, 1, does the hamstring touch the table? In this case, no. You can see this gap here. So what that might tell us is that we have some restriction, possibly mobility issues in the hip flexors here. And in this case, maybe even the rec fem, which is going to be one of the quad muscles that crosses both the hip and the knee. So the second thing we're looking for here is the shin perpendicular to the floor? So this would be a 90-degree angle that we're looking for here. And we see that that is also a negative here. So that's all right. I'm just as tight here. So what we're looking at is rec fem, knee and hip, probably going to be the tight tissue here. There might be some other hip flexors that are going to be involved with this. And then our third, which this is actually a good sign, is does the foot and hip turn out? In this case, it's looking pretty straight on midline. So what that would tell us is if there's some tightness here in the lateral hip. So in this case, lateral hip is looking pretty solid. There is some stuff that we want to further evaluate, looking at more so the quad / hip flexors here. Awesome. Let's go ahead and switch sides. So we'll come back up. Now we're taking a look at the right leg. So hugging the left knee, lay all the way back, nice and slowly. Awesome. And initially when doing this, we're going to give a second to just kind of settle into this before we kind of make these evaluations, because what we may find, usually that body is going to be a little bit tight and guarding. After about 20, 30 seconds, maybe even longer, we may see an improvement in range of motion just from the relaxation. And we see very similar to the right side. Hamstring not touching the table. Knee is not quite to 90 degree as well. And then we're looking pretty midline here in terms of the turn out. So lateral hip is looking good. Again, that same kind of result that we're finding on the right and the left, with some tightness on the anterior side of the quad and hip flexor. Awesome. So that is the Thomas test. Any questions?
Nope.
Sweet. Cool.